We are live.
Yes. So good evening, everyone. Very happy to be part of this session because this is the most important part of end of your prelims and going to be mains preparation when you within 24 hours. Maybe you studied more than 6 months or more than 1 year, maybe 2 years. This is our duty to as being a number one institute and with good success rate, nearly 70% success rate in prelims, we are entering into the mains for our media students as well as for outsider. So we are here to happily share our just brain buzz, which we usually do that offline. But this time we need to get benefit from everyone. This is my special edition. Quick review of the sessions as well as for you, it will be useful for your exam hall preparation. So success always depends on how you do hard work, and mostly everyone have done that for 6 months or 1 year. I'm sure that be positive and always you go with the success, right? So why Meteor is special always? So I'm here with ex-AIIMS who have resigned the job and here guiding the students who successfully. That's the reason why Meteor is always getting 70% result. So this time we have achieved nearly 1,350 achievers in prelims, and they are going to appear in mains. So for them also, we congratulate for them as well as outsiders, those who are watching this session. And this session is just for your knowledge, how to appear in this, what to study in the last moment actually. So we usually do that in the offline marketing, which I said before. You can see that this is what actually we do the brain buzz, this is very important for you for the last moment because the one liner which you will be studying from here and there, but it is our duty that we have to go with this at the last moment because you have nearly 24 plus 12 hours, 36 hours. So in that, maybe 3 to 4 hours to have the quick review of this. So I'm not going to discuss everything. I'm going to just have the, since I'm mentoring for the student nearly 10 years. And so this always I do the last moment, but this time we are coming on YouTube, and so that students will get aware of what is this, because this is a turning point of your exam. Usually the students will tell nearly most of the questions, 20 to 30% questions directly from this brain buzz, and it covers nearly 600 key points. Maybe it will take 2 hours or 3 hours for your revision, quick revision. So when you do this, when you are maybe tomorrow at last 6 hours or last 5 hours, when you are traveling, so you have the quick review of key points which we covered. If you think about, we covered about cardiac system, the key points, and people maybe studied everything everywhere. And if you think about LAD, what is the most common MI, and what is anterior wall MI, and which lead will cover anterior wall MI V1 to V6, last NORCET question. And in that also you should be very clear: V1, V2 septal wall, V3, V4 antero inferior, V5, V6 anterolateral. And this anterior wall MI is most commonly seen in the clinical. And RCA, which is blockage, which goes for the inferior wall MI, and which well as Brady, as well as the lead, which is lead 2 and lead 3 and AVF. This is what actually we do in the last moment, so that we can recall the quick revision of all the subjects. So if you think about this, we have the system wise cardio, respiratory, gastro, renal, and the key points which we have not added many, right? 12 to 13 key points which we have. And apart from that, we went for the bullet points, which will cover all the key points, investigations, right? And all the conditions, med-surg conditions, drugs, antidotes, and which is covering all the positioning. You can see this. And you have fundamentals, very important for the students. You know that the coverage of nearly 40% question from med-surg, as you all know that, and 30, maybe 20 approximately, the coverage last two mains we see, OG and child health and psychiatric, and the research maybe 3 to 5 questions. Section wise, we are writing 4 sections, so it is always useful for you. because it will cover everything. So fundamental, if you think about this, if you go through this, and this is what actually more than enough, because this will cover all the questions of fundamental, and it's a quick review also. So all the IV solutions and the positioning and everything we covered here. And we have once again elaborately we have all the place for pediatric conditions, growth and development, everything we added. And child nursing, we get a good quick review of the content, right? So what we feel, some students said, sir, we have cleared only because of this brain bus. And most of the questions last time when you see prelims and this one, we don't want to go for questions which is there in your many books. The key points, if you are remembering the key points, that is more than enough, right? So we give 60-70% of questions from this brain burst, and mostly this will be covering your upcoming session also in the mains exam also. So in community also we covered all the important key aspects, those who are going for the first time, right? So you will be covering all the vaccinations and all the important key points which repeatedly comes in your exam, programs, which is the recent programs updated, and all the indexes, committees, and these all we cover in community. And mental health nursing also we have the key points and signs and symptoms, and especially terminologies, which is very important. And OBGYN, we covered all the important key aspects, because you are not able to having time to study everything, and this is what we are giving last 3-4 years, and now it's available in your app store. So you can download any students who need this. It's You can download the app and you can open that and you can see before the exam. Why this is important, I will tell. So because this message topic, if I want to start, you can see, just if you see, we started with anterior wall, inferior wall, and we see that some of the questions, previous year questions, right? NTG, last before NORCET questions, which is contraindicated for some of the cardiomyopathy, which we should not use vasodilation because it worsen the hypotension, especially in the right ventricular infarction, it will get worsen the hypotension. And S3 sounds, which is seen in congestive heart failure. S4 is cardiomyopathy plus hypertensive severe condition will be seen. Widened QRS loss before NORCET. Usually QRS interval duration, they may be asking 0.6 to 0.10. And this is a key point which you have. Widened QRS, they've given. Widened QRS conditions always it's seen in the ventricular arrhythmias. And if you think about atropine, we usually think atropine dosage maximum 3 mg we have to give, because during, as per the ACLS guidelines, atropine is a very important drug for the symptomatic brady, not asymptomatic brady. That's a key point in your competitive exam. Symptomatic brady is different, asymptomatic is different. So symptomatic brady, we have to use atropine. And if you think about aminoduran, which is very important first line drug for stable patients of VT, and unstable patients also we can give. Stable we give 150 mg, unstable we give 300 mg, and this is very important drug for the antiarrhythmic first line of classifications. And Bex triad, cardiac tamponade, medical emergencies, how we manage, and pericardial synthesis we do. And we have warfarin toxicity questions also, and very important HITT. HITT is another important question which usually given important because patient may go have the thrombocytopenia. Right. So thrombocytopenia may either after heparin stopped, or during the therapy after 2 to 3 weeks also they may get thrombocytopenia. That's a very important question, complication of the heparin therapy, and that is the reason why we do the bridging and we shift the patients to direct thrombin inhibitors. It's very important drug. We use dabigatran, we use argatropium. So these all the direct acting inhibitors, thrombin inhibitors. It's the last NORCET question. Which of the following drug is an example for the direct thrombin inhibitors? So we have dabigatran, we have argatrope. So these all the drugs usually be very important. So basically we given this, and then after that we given elaborately one key points from the message. So all the cardio, this is just key points, and then we covered one by like A series, B series, C series, all the signs and symptoms, so that overall all the disease condition we have touched. And this is the small key points which I usually give immediately. Because respiratory we get we have most common site of aspiration. Why it is right bronchus? Recent question of NORCET. Right side of lung is going directly towards the this bronchus is going straight, and left is going to the perpendicular. That's the reason why we have all the particles which is entering into the lungs, which is going to right side, and moreover common site of aspiration also right side. Its anatomical location of the lung is very important. That's the reason why right brain bronchus is always even absent breath sound. When the ET tube is fixed more than 26, actually that the ET tube will enter into the right side of bronchus only, right? So absent breath sound will be seen in the left side. It's a very important question. And COPD gold standard diagnostic test is always spirometry. And just now we had a session before, less than if it is less than 70.7 or 70%, always decrease FE1 FEC ratio is always very important. In COPD, in asthma, FE1 FEC ratio will be decreased, and that is known as type 2 respiratory failure. So these are all the quick review. You have to type 2 respiratory failure and type 1 respiratory failure. Both are important. So type 2 respiratory failure comes in COPD, asthma, and so on so. And type 2 is always hypercapnic respiratory failure. Type 1 is hypoxemic respiratory failure, which is also important. You have to note this. Hypoxemic respiratory failure, where the PaO2, this is the quick session. I'm not going to go with elaborately. Just I'm giving idea. After that, you can download and you can study from the app, right? So that tomorrow journey you can travel journey, you can use this key points. Say PO2 less than 60 is always hypoxemic respiratory failure, and difference between bronchitis and pink buffer, which have very clinical classifications. Bronchitis, there's some person with 3-month cough with 3 years continuously. If they have protective cough, non-protective cough is not a classical manifestation of the bronchitis. It's a protective cough which have patients with 3 months to 3 years. That's the chief complaint usually they have, and that is the reason why bronchitis is suspected. And moreover, it's a blue blotters because sinus is prominent, and it's a pink buffers because alveolar get ruptures, and because of antitrypsin deficiency, the patient will go for barrel chest, and that is known as emphysema. So peripheral sinuses is a prominent features here. Central sinuses is common in the bronchitis. So basically, that whatever you go for the exam, you should have this clear idea about the condition. So how the tension pneumothorax we manage. First line of management, we go for needle decompression, and the second line of management, we go for ICD. And ERDS, the question came, prone position is very important. 16 to 18 hours as per the guidelines we give, and low tidal volume should be initiated. Ideal body weight, not from the kg, it's ideal body weight. Starting normally 6 to 8. Low tidal volume, you can start from 4 to 6. ARDS patient, mostly we can start from 4 to 6. Pulmonary embolism, medical emergency, where usually we assess the well score. Well score is also important here, right? So well score is a very important key point, right? Just a minute. Yeah. Because last moment, I don't want to sit and explain deeply. This is for quick review, and so that you can have confidence in this. I hope those who clear this all the key points, you will be in the good rank. We pray that you will be good rank, because these all important aspects of the question in the exam. So pulmonary embolism well score, which is especially well score is very important to determine whether to start anticoagulant or not. So this is maybe your important question criteria scoring. And ripe regimen, tuberculosis, so you are very clear. And asthma you get question immediately. We give oxygenation 6 to 10 liters. COPD we give 2 liters, but face mask with oxygen we 6 to 10 liters. We give oxygen in the asthma exacerbation immediately, along with the first line of management. You all know that inhaled salbutamol, beta agonist we give, not beta antagonist. Beta agonist is very important drug. That is salbutamol, LABA, and SABA. SABA usually we start, and then we go for LABA. That is albuterol plus ibuprofen. We give LABA. Initially, salbutamol we give SABA. So on chest tube drainage, 200, more than 200 per hour post-operative hemorrhage, chest tube questions can come. When the chest tube question comes, you should know the clamping criteria. Never clamp the chest tube during the shifting, especially for pneumothorax. You should never clamp the tube when you are shifting the patients to MRI or CT. Always clamp the tube when during a discharge, or immediately when you are shifting the patient from bed to trolley. So you know the clamping guidelines. Many people do this mistake. We clamp and send the patients for investigation, but especially for pneumothorax, we should not clamp the tube. That's very important question. And moreover, it's clinical guidelines, right? And the weaning criteria of chest tube also you should know. Follis criteria weaning also you should know. Chest tube weaning criteria less than 50 ml into 3 days continuously. There is no oscillation present. There is fluctuation, oscillation absent or that is resolved in pneumothorax. We can plan for weaning. Ongoing pneumothorax, if any fluctuation stops, that indicates blockage and any clot or anything. So ICD normally duration is 3 to 5 days. So weaning guidelines, everyone should know very clearly. Right. So whatever doubts you can just chat in the this one doubts. So we also come back in this comment box. You can comment. Right. So these all just I'm giving the superficially because you can recall one of the common question from the flyal chest. It's also emergency condition how we manage immediately with IPV, intermittent positive pressure ventilation, and paradoxical chest movement. Paradoxical unilateral chest movement will be assessing the patient in trauma emergency, and more than 3 ribs fractures happen in the flyal chest, and the patients will be sedated, and they'll go for assessing the patients, immobilize the patients with sedation, and muscle relaxants also will be using, and that's very important for the trauma emergency. Like how we studied ARDS patient, PO2 FI2 ratios, how is important. The exam question PO2 FI2 ratio is important, right? Same like here. And neurology also, we have the key points, how we start TPA, what is the difference between hemorrhagic and ischemic stroke, how we can classify, what is Cushing triad, last NORCET question, Parkinson triad, tremor. It's a clear on the, you get a clear idea. This is the key points. Just for quick review, maybe you can finish within 2 to 3 hours. Okay, and GBS, and we have discussed myasthenic gravis, and meningitis, and Bell's palsy, and all these 10 key points we have. And then renal system, GLM, we had 10 key points. I just pick up the 10 points so that at least every system 1 or 2 questions can be covered in your exam. And it's very important as the guidelines which we follow, what I follow, which is rich experience of nearly 18 years of clinical experience, especially in Chimber and AIIMS, almost 18 years I completed. So we know that which is important. And moreover, this is also it's a good for your competitive exam. When you go for, you should know the exactly what you have to select for the answer. Signs and symptoms, or the management, or if I think octreotide we are using for esophageal varices, yes, it's a good drug for the cardio protection. Instead of somatostatin, we don't use for cardiac cases. Somatostatin we don't use. We use octreotide. It's a good drug. So this is what how you have to learn, and you should remember last moment. And diverticulitis is left side is appendicitis, right side on the appendicitis will come. Left side appendix is known as diverticulitis, and we have cirrhosis of liver, which is also important. And ascites complications are very common. Budd-Chiari syndromes you can come in the question, right? And how we manage when the patient go for hepatic conditions, we use lactulose syrup too early, right? And when the patient go for hepatic condition, to have to reduce the anemia, we induce the diarrhea. That is also very important question. And unless until patient having cirrhosis of liver, where the MELD score, child puck score will be assessing, and MELD score will assess for the liver failure for the transplantation. So these are all the key points you should know. And upper GI bleed, we should not go for see NGT lavage is that upper GI bleed no. So just small mistake. We should not use any upper GI bleed. Patient comes with cirrhosis of upper GI bleed. அதாவது யூசோஃபேகல் where is it GI bleed இருந்தா right tube is not indicated immediately. We should not put, right? And that's very important question. Endoscopy they will do, and they will go for the finding. Pantocell infusion will start, and then octreotide also we can start. Right. So same like we have all the key points which is given here, like dialysis is very important questions, which is UTI as well as pyelonephritis questions are very important. And how you rule out the peritoneal dialysis and hemodialysis. What is a fistula we use commonly, right? Gold standard is AV fistula, not a AV graft. Okay. And then how to differentiate the nephrotic and nephrotic syndrome, right? And then how we use hyperkalemia management. You know that earlier changes is T wave, and if it go more than 6, they will be giving calcium gluconate as a priority choice. If less than 6 are the, I'll give insulin plus dextrose as a first line of management. Right. Generally, we have to know each and every key point. So based on this, we have framed this one-liner. So one-liner covers all the medical emergency. DK is one of the most repeated question. You should know what is anion gap. When the anion gap is elevated, what does it indicate? It indicates metabolic acidosis, right? Even Meteor students you can answer, as well as non-Meteor students, you should be very clear what you are studying. And moreover, all the key points we have mentioned the endocrine also. Based on this, I framed nearly 10 chapters. Hematology also we made it, which is very important last, because you see each and everything I can highlight the question. Neutropenic precaution, absolute neutropenia count is a repeated question in your aims, less than 500. So many people are not aware of this. A less than 500, B less than 1000, C less than 2000. So they may make you clinical. If you are in the clinical, you are able to crack exam more easily, or you have to study more deeply, right? Because you may be studying from YouTube or anywhere, students who's may be guiding your mentor anywhere. It's a common platform, so you can study anywhere. But at same time, you should know what you are studying exactly, what you need for the exam, right? Scattered bunny, if you are studying scatteredly here and there, you get more confusion. This is what especially I advise. So you have to be very particular in something which you have to focus. And a social media platform is always there to utilize best, and also it also became worst also. Both it will happen, right? So here we are bound to have the quick session, because you people can download this in the app link which is given right in the description layer. You can download, and you can just see this LMR quick one liner. It is open for all, not only immediate students. This is open for all, because this is, I personally framed this one, and it's very important for your exam also. Right. If you think about infectious disease, only key point we have MRSA, which is a drug of choice. They may ask you, MRSA is very important question. Vancomycin is a drug of choice, and difficile anti-associated diarrhea. Right. Penicillin groups like augmentin and many drugs which causes diarrhea in the clinical. We usually give C difficile, we diagnose, and we give oral vancomycin. Also important. The LMA clinical finding, which I worked personally for 10 years, I put a point here, like DAC, how we, DAC, what is the finding? Okay, what is the finding we do? So every disease conditions we have, elaborately we can write more than 2 pages, but you know that this is the key in the exam purpose, and this is very important for the competitive exam. So based on that, many people go for sickle cell crisis management. They'll go and take oxygen first line of management. No, first line of management is hydration. Then only it come for oxygen. Okay, so these all the some of the thing which you have to understand, and moreover, when you go for pharmacology, there will be question the antidote. So all the antidotes and the key points also we have given, and you know what you'll assess in your drug. What is the side effects you'll assess? That may be the question also. So first 10 key factors which will cover mostly nearly 20 to 25 questions can cover in your maybe your mains. Maybe you see, maybe you feel like this is not covered, but if you think about the scenarios, it will be applicable, like lactate sepsis bundle, where lactase is increased, antibiotic steward guidelines. You know that culture we have to send, antibiotic we have to start before, sorry, culture we have to send, and then we'll start for the antibiotic with fluid within 1 hour after doing the sepsis. Right, sepsis bundle, we have to be very clear where MAP should be greater than 65, and then we have to check procal value we will be checking, and then when the procal value is elevated, patient go for severe sepsis, and we start the fluid, especially septic shock on the, we go for RL, we don't give NS. So these are all the points which is you have to learn from the clinical only. Most of the people go and take NS, but septic shock metabolic acidosis is very prominent, so we don't use NS, we give balanced crystallite, that is RL. Remaining hypolimic shock we can give NS, but septic shock we use RL. Okay, so and come for the adrenaline dosage is very important. Always give the question 0.3, 0.5, or 1 mg, 10,000, 1 mg, 1,000, 1 mg. So that is the one more question which always we get confusion. That is also very important question which you have to note down. And then fluid electrolyte with the ECG changes, we covered very clearly. Normal anion gap questions also. So mostly in the first 10 chapter, you get nearly 20 questions. Okay, this is what my always predict. And this is very important also, since I am teaching for last 10 years. So we know the questions from the 2016, how the questions will come. So this is what how you have to learn, and moreover, I have described everything. Even the link level, you can go and click. You can see that all the signs, all the priority signs and symptoms, everything will be covered in neuro, and important highlighted symptoms. Right, message carbon poisoning, arsenic, copper lead, and there will be antidote. Right, and then all the antidotes, as I said, you can see all the antidotes, all the skin conditions mostly. What is the findings you will find in the skin condition? Right, message is vast, but apart still also we will be covering all the anatomy and physiology, quick review, and then condition positioning is very important. As you know that positioning compulsory, 1 or 2 questions will come. So this is a format. Just I want to have the quick review for you people, because everything we can't able to take, and I'm giving the orientation that key points are your execution. Okay, so it is prepared from by writing and then typing by our own, by seeing the books, and we know what is important. And all that, this is very important for your especially I prepare specially for the students, those who are going before the exam. At least they have to watch for 2 to 3 hours, so that it will be motivated for them. And sollama, if we are not informed that, because many people will give many things. See, Meteor RK, because I'm always special for my students, and moreover outside, because resigning the job and no one is taking the classes. Everyone is taking as personally, but resigning the job and coming and taking classes is always special, and our students love that. So that is very special. This is usually we always give importance to the clinical, right? And moreover, you see all the points which we added, and it is utilized clearly. It is given, and moreover, you can just go through one by one. At least tomorrow, maybe 6 hours. Okay, so all the students, those who are going for mains, please go through, especially for media students. Media students are the no issues. I hope everyone will go through. Right, because many people have many notes and other particular, maybe you get confused what to study. This just we are giving just myself. I am giving awareness, since we are the leading institute now as per success rate percentage. We science verified students nearly 1,200 who cleared prelims, right, and more than 60-70% success rate. We are the one we are having across India, right, and that is many institute if you all know that. But still we are leading because of success rate and because of our lovable student who's trusting us, and who are sincerely studying for 6 months or 1 year. Right. So this is what actually I want to do. And moreover, you can ask me, sir, how much to attend? I don't want to tell how much of questions you want to attend. So it is up to your preparation. And I will tell if you are preparing for 6 months or 1 year, if you are dedicatedly preparing, always I will tell go and take a risk for more than 145 or 150. Negative marking will be controlled less than 30, not more than that. These two criteria you follow and you will be in the rank. Less than 30, not see when you attend this much of question, negative marking should be this. When you attend second criteria, when you attend 120, and the negative marking will be should not be go more than 15 or 20. So don't attend the question less. Better you attend the more questions, because those it's applicable for those who prepared. It is not applicable for those who not prepared. Right. Negative marking is always a trouble for the student. And moreover, I tell those who prepared well 6 months or 1 year, I will always tell go and take a risk in the exam. Okay. Don't be in safer side. Right. People will tell don't attend. If you have this clue and two elimination pattern, if you are applying, and go and take the risk for nearly 150, 140 with 150. There is no aptitude reasoning. So better you can go with the at least 140 with 150, and keep your negative marking under control less than 30. So this is a mantra and brain buzz I want to give for all students, those who are appearing for the exam on Saturday. Right. So since we are the, as I said, we have to give in this time, we have to come up and successfully we have to give our ideas for all the students. So NORCET 7 topper, NORCET 8 the second, and this time also we had a prelims topper, rank 1, and mains also we expect that our students will crack rank 1. Right. Let's see. That is when the result comes. Those who need this one, this pamphlet, you can download our description, which is given in the below the YouTube channel. There is something which is given, right? You can see app link is given. You can download it, right? And you can just download and log in, and you can see this PDF. Okay. So this PDF will be most useful for at least when you study for 3 hours. Everyone have studied the competitive exam, maybe 6 or 1 year. So இது படிக்கும்போது it will be all exam related PDF, and it will be most important for you. Okay. So this is what I want to tell today, because tomorrow everyone will be traveling busy, and one day before I highlighted, because people are everyone have the master track, main series, crack, everyone other. When we see everyone is doing, and media is always special for everyone, because no one everyone knows that we are the one who's having good percentage of success. Once again, I'm giving this advice. So go with this and do well, and your day will come surely and get a good result. Be positive. Yeah, right. Get success. I'm sure that your hard work will always end with success. Right. So thank you so much for joining me. This sessions for quick 30 minutes. So I don't want to waste your session because in your plan, you may be planned for something studying, maybe 6 hours, 6 hours, something to plan. So on that time, if I come and interfere, it is not good. But still, I want to give today itself the tactics which I want to tell. So you can follow better. That will make you success in your exam. So thank you so much, those who are watching, and comment in the chat box. Let us see what are the doubts you have, so that next time I will come. Let me see the doubts I can clear you. Right. So thank you so much. Thank you so much. Yeah, Gokul, you can wind up. Yes, Gokul, are you there?